Good afternoon, everybody. Welcome. Thank you for joining us today to learn about this exciting new pilot program that we are implementing out of the Office of Child and Family Services in Maine. My name is Alyssa Wynn. I'm the Associate Director at the Office of Child and Family Services. I oversee early care and education and children's behavioral health services. A couple of housekeeping items before we get going. Please, everyone remain muted for the duration. If you have questions that come up for you while the presentation is happening, please feel free to enter them into the chat box. It should be at the middle bottom of your screen labeled Q&A. The webinar is being recorded and will be posted on the website following, in the event that there are folks that couldn't join today but do want to hear about the pilot program. At the end of the presentation, we will, depending on the time that we have, answer the questions that come up in the chat during the presentation. Slide, please. Today, these are the panelists that you'll be hearing from to learn about the model. I'll talk a little bit about, in Maine, how we came to this place. Then you'll hear from Liz Bizio, who is the developer of the model and consulting with Maine on our strategic implementation. Following that, you'll hear from Advanced Behavioral Health. We have Sam Moy, who's the CEO there, and Caroline Finley, who is the ECCP, or the Early Childhood Consultation Partnership Program Director. And finally, you'll hear from Amy Beaulieu, who is our Maine ECCP Program Director. I'll start with a bit of a background and history, as I said, about the model and how we got here in Maine. We'll hear from Liz then about early childhood consultation nationally. ABH will then talk about their specific model that we're implementing here in Maine. Amy will talk about some next steps for the pilot program, and then we will answer your questions as time allows. So to talk a little bit about the background, in 2018, there was a report commissioned by the Legislative Joint Standing Committee on Education and Cultural Affairs. As a result of the report, it highlighted that Maine had the second highest rate of public pre-K expulsion nationwide. This was as a result of some research done by Dr. Walter Gilliam in 2005. The group of folks that worked on the project were across multiple settings. So advocates, early care and education providers, parents, families, state government representatives, and some national consultants. As part of the project, the providers, early care and education providers were surveyed, and they found that managing challenging behaviors in children was one of the biggest issues that providers reported that they were facing in their classrooms. The first priority recommendation out of the 2018 commission was the development of a statewide early childhood mental health consultation program in Maine. Fast forward to 2019, LD 997 was an act to promote social and emotional learning and development for young children. This act was passed by the 129th legislature, which was prior to COVID. Providers and stakeholders were part of that legislation, and many of you on the call were probably part of that development. Sorry, I got distracted by a pop-up. The legislation, in short, required a voluntary statewide early childhood mental health consultation program for children ages 0 to 8 across multiple settings. The program needed to provide support, guidance, and training to educators and providers to improve their skills for managing the challenging behaviors of children in the classrooms. The program is intended to be completely voluntary and will cross multiple ECE sectors, including public elementary schools, childcare settings, Head Start, and working with foster and resource families. Thank you. So following the legislation, the Office of Child and Family Services worked to implement the statewide early childhood mental health consultation model. The legislation did dictate that there should be a pilot period prior to the statewide implementation, which would include 5 pilot sites. And you'll hear more today about how the pilot is rolling out now. Early childhood mental health consultation has existed in Maine in multiple forms over the years, including Project Relate through the University of Maine, as well as the Early Childhood Consultation and Outreach Project in Washington County, to name a couple. The state had a very stringent timeline as a result of LD 997. And so the search was on for a model that could be implemented within the timeline, but also have outcomes that we needed for the youth in Maine and for the providers. The department looked carefully at a lot of models across the nation and ultimately landed on the Early Childhood Consultation Partnership Program, will be known as ECCP going forward in the webinar. ECCP was identified as one of the only models with scientific research that demonstrated positive outcomes for young children. It's also one of the only models that's being implemented on a statewide basis and is being implemented in Connecticut, where it was originally developed. It also comes with a data system that's integrated into the model and allows for tracking and outcome measures and monitoring fidelity to the model. So we are very excited to be implementing our own version of ECCP in Maine, which will mirror what's happening in Connecticut and be implemented to fidelity of the model. With that, I'll turn it over to Liz Bizio to talk about early childhood mental health consultation on a national level.
Thank you, Alyssa. Hi, my name is Liz Bizio, and in addition to being the developer and early director of the mental health consultation program, the ECCP in Connecticut, I had the role, the opportunity to have the role of National Director of Infant Early Childhood Mental Health Consultation for the Center of Excellence. And so with the next few slides, I'm going to be speaking to some of what we put together at the national level so that we have a bit of an overview of what is mental health consultation. And so next slide. Okay, so the definition, that many different people from across the country came together to really hash out what is this mental health consultation and how do we define this. So this is the current best definition at a national level of mental health consultation. So we say here that it's a multi-level preventative intervention. So this is not treatment, it's prevention. This intervention partners mental health consultation professionals and early childhood providers to increase their capacity to support the children's social, emotional, and behavioral health so that they can develop, learn, and succeed. So essentially, the mental health consultant works in partnership with caregivers or providers of young children so that they can help build their capacity to have better relationships, with young children, to improve their social emotional development, and to avert mental health problems or disorders in the future. Next slide. We needed to come up with a visual that folks at any level, whether it's policy, right down to those doing this hard work, on the ground, could have an understanding of. So we came up with, we have this triangle approach. And basically what we say about infant early childhood mental health consultation is that it fosters nurturing environments where healthy relationships grow so that children can succeed. So it's not just about the child, but it's about working with those who work with children and the environments that children are in to support their health, growth and development. So a big focus is on relationships, certainly, and nurturing environments so that all can succeed. So in this, this infograph here, we really demonstrate that, in the bottom left-hand corner here, that we need a qualified mental health consultant that works in partnership, as you go up the green arrow, to build the capacity of caregivers or providers so that those caregivers and providers can help realize outcomes for young children by having better connections with them, supporting families better, and so that the outcomes can be achieved. Next slide. It's applicable to a wide array of service settings, which we'll show in a future slide. And mental health consultation is based on, it's out of mental health, so it is a mental health service. It's prevention, it's not treatment, so it's not therapy. And so we are focused on some of the principles of prevention and also consultation, which again works with caregivers so that those caregivers can work better with young children in their care. And we look to strengthen the providers in their efforts, to support children and families, and environments. So here we say accessible mental health, which is that mental health consultation goes to those natural settings where children and their providers are. So it brings mental health to those children. It builds capacity. So it builds capacity of the providers to create nurturing environments where children thrive. And it really looks at child outcomes so young children can succeed in learning and also importantly in their relationships. A lot of, in terms of the development of the ECCP, one of the folks that really was a great inspiration to this model was Dr. Jane Nitzer. And so we have one of her quotes here, which is, "The best way to help young children is to help parents and other adults closest to them." I'm going to talk a little bit about what is a qualified infant early childhood mental health consultant. Again, this is coming from the national level, where we have many people around the country in different programs really coming to some type of a consensus of this. So we do require a master's degree in the mental health field, a clinical license, and experience with young children, experience in service delivery, experience in mental health. We also look at additional expertise. So the consultants have expertise in training in trauma or trauma-informed care, infant early childhood mental health. So that diagnostic side, even though they don't diagnose, they have an understanding of what is typical and atypical development, what begins to go into mental health problems or diagnoses so they can help avert that. They have a good handle on maternal depression, on substance misuse, risk and resiliency, and different types of systems or dynamics. So the consultant is versed in a number of things that take them beyond what a therapist may be trained in, so that there is additional expertise that is required here for this position. And then finally, in terms of workforce development, that there are a set of infant early childhood mental health consultant competencies that guide the training and hiring of consultants, as well as their professional development. There is specialized training, like I said, and ECCP will review a little bit of that later. And there's also training in terms of, data collection, fidelity training, and quality assurance and outcomes. So not only do we want to deliver services, within the boundaries of the role of the mental health consultant, but also we want to make sure that those services are of high quality, so that there are a number of features and trainings that are in place to make sure that the consultants are staying on track. And then certainly there's supervision that includes logistical administrative supervision, so to make sure that the consultants are doing what they should be doing, when they should be doing it, but also that reflective supervision that has them reflect back on their practices so that they can continue to improve any practice behaviors or outcomes. Next slide. Consultation, is applicable to a wide array of infant, early childhood, and young child service providers and settings. So, across the country, it's used in many different settings, including early care education, Head Start, home visiting, pediatric primary care, and so forth. And for our purposes here, we outlined the types of settings that the ECCP or mental health consultation is going to be addressing within the state of Maine. So we talk about this in terms of Head Start, so consultation to Head Start and early Head Starts, okay? Center-based childcare and nursery school consultation, family childcare consultation to family childcare providers, child welfare consultation, school-based consultation, and also after-school care consultation. It uses the same mode of delivery in terms of consultation. That's why we show these triangles throughout, and has been shown to be effective across a variety of settings. Okay. The outcomes or benefits of mental health consultation. Mental health consultation, it's an approach that's backed by evidence. And the most rigorous of this evidence comes from the Early Childhood Consultation Partnership, or the ECCP program, which went into Maine's decision to select this model. So it has evidence for reducing challenging behaviors. It has evidence for reducing impulsivity, improving children's social skills, preventing preschool suspension or expulsion, or the likelihood that a child would be suspended or expelled. Improves teacher-parent partnerships. We believe that the partnerships are most critical for success with the program, that if we're effectively partnering with teachers and parents and directors and providers and principals and so forth, that this is going to be, a long-lasting, benefit. It also indirectly impacts improving the relationship between the child and an adult, reducing provider stress, burnout, and turnover, and actually helping to stabilize parental employment. Next slide. Overall, when we're taking a look at mental health consultation and effective programs, there's two main components. One is that you have a highly qualified and trained, supervised and supported workforce. And the other is that you're working within a model that delivers the consultation, that has quality assurance and outcomes. So here I want to talk about that effective delivery of services containing both of these things. So delivering consultation through an evidence-based model. Here it focuses on a highly qualified and specialized workforce, the effective service model that has built-in flexibility. That means that you can tailor this to the needs of your state, to the needs of your community, to the needs of the classroom, the teacher, the family, and so forth. It has the highest degree of assurance that the child outcomes are going to be realized. That's what a rigorous research and evidence base does for you. And especially if you're looking at scaling a program, to large populations or across the state, you want to have a higher degree of assurance that those outcomes are going to be realized, because you're making a very big investment in people, time, and you want those outcomes to be the best that they can possibly be. And also each program, that is evidence-based and highly effective has a set of feedback loops that inform a continuous quality improvement of that program. So throughout the ECCP, experience or learnings, you'll see that there are feedback loops at every level to continuously help, those running the program understand what's working, what's not working, and how to revise that. It also hosts an integrated systems approach. So again, with this model or effective models, they partnership at every level. So at your state level, your community level, your family level, your center or provider level, that there's a shared vision that we're all here to help and support young children. And that collectively we can really reach some pretty big goals across the state, whether that be to reduce suspension, expulsion, to improve quality care and so forth. So we're part of, the answer to that larger population impact. And with that, I'm going to hand it over to Sam Moy and Caroline Finley to talk a little bit more about the evidence-based early childhood consultation partnership program.
Thank you, Liz, for that very helpful background and the national perspective. My name is Sam Moy. I am the president and CEO of Advanced Behavioral Health and serve as the director of the ECCP program. And Caroline Finley will also be presenting with me, and she is one of the program managers for the ECCP program. And she is going to be the main person working with the state of Maine in terms of the implementation of the program. Just to give you a little background on Advanced Behavioral Health, we are a nonprofit behavioral health company in Connecticut, where we do a lot of program development and quality assurance. I started at Advanced Behavioral Health in 2001. The organization is about 26 years old now. And one of the first programs we were fortunate enough to develop under my role there as president was the ECCP program. And so we're going to describe some of the ECCP program for you so that you have a good sense of what's happening in the near New England or southern New England state, to give you a sense of how we have been able to really implement a really strong program that has had a very positive and substantial impact on young children and families and those who care for them. So with that, if we go to the next slide, give you the views. So the program has been developed and managed by Advanced Behavioral Health. Liz was the model developer when she worked with us for over a decade and a half. Back when we in 2002, the initial goal was to reduce suspension and expulsion. We have worked closely over the years with Dr. Gilliam from Yale, who has done a great deal of research in this area of services for young children, and his are the best studies on the impact of providing high quality services and how to really support services and work for young children. ABH was really over the last 18 years continuing to develop and refine the model. We've developed a centralized information system that really helps to both document the work, to capture data, and to really help the consultants to deliver the model with fidelity. It is an evidence-based model, and to have good outcomes that are consistent with the evidence base requires that providers implement the program with high fidelity. And we've developed our information system in support of the ECCP program to really assist consultants in making sure that they are delivering the program with high fidelity so that we can get the kinds of outcomes that we're all looking for. And over the years, ECCP has really developed into a comprehensive system for infant early childhood mental health consultation. And so in Connecticut, where we've had now almost 2 decades of experience, our consultants are situated throughout the state, and our resource, obviously for all the early providers, they provide all sorts of consultation to their community. They work closely with our child welfare system and working with social workers and child welfare systems to help children who are at risk and in need. So we can go to the next slide. ECCP program is statewide. It is evidence-based. We have collected a great deal. I will describe a little bit study that Dr. Gilliam conducted that demonstrated some of the outcomes that Liz mentioned earlier in her presentation. The program is manualized, meaning that we have really developed a very detailed process for pre-service training and for ongoing supervision of consultants, so that consultants in different areas of the state are delivering the program with the same types of service and fidelity to the model in terms of the number of sessions and what happens in each session, the data that is collected, how that is pulled together into what we call action plans to really help to facilitate the kinds of positive outcomes we've been describing. There's a central administration and information management systems. So that is ABH's ongoing role in terms of program management and supervision and the program development, because for example, with COVID, we have developed more work in terms of providing consultation using teleconsultation platforms. And we just continue to evolve the model to take advantage of the best information that we can. We provide a great deal of training for the infant early childhood mental health consulting workforce. We're very excited to have started our work in Maine, and we have consultants who have been hired and trained and are just starting their work who have a great deal of experience as clinicians and consultants, and we're providing them with a solid base of information and education on infant and early childhood mental health consultation so that they can really be equipped to be a resource to the centers and families that they work with. Over time, the program in Connecticut has really been embedded in the early childhood system, and our hope and expectation is that it will provide a similar resource for the state of Maine as well. And it is cost effective. The model, depending on your perspective, is fairly structured. It is short term in the sense that we're not in centers for months and months and months. We're in there with a very focused agenda to provide really effective interventions with teachers and families and parents to really help them to help their children in terms of their social and emotional development. So with that, let me turn it over to Caroline Finley, who will share some additional information about the program.
Next slide. Hi, so I'm Caroline Finley. I am one of the program managers here in Connecticut, and as everyone's mentioned, I'm taking the primary role of ECCP to help the implementation in Maine. So what I'm going to describe in this slide are the three main or primary levels of services that we offer through ECCP. And I'll describe them in a little bit detail. The child specific. So a child could be referred to ECCP with a variety of different presenting concerns. These are typically situations that may not result in a higher level of need for intervention. So it could be something as simple as a child has transitioning issues, a child is a little bit slow to warm up. It could be, there could be some potential concerns about some behaviors. Anything that's really presenting this child as a challenge to the teaching staff and to the center or to the families that are struggling with this child's behaviors. It's designed to help support the one specific child with any sort of social, emotional, or developmental concerns. It's a 6-week process. There's an initial meeting, an observation both at this classroom and in the home. We create an action plan of goals and strategies. We provide 2 action plan support visits, and then we make referrals as needed. As part of this process, there's also some screening tools that we use to see what needs might be present across both the home and the classroom environment. The next level is a core classroom service, which is our broader program, which lasts about 3 months. And this is to help support the teaching staff of a particular classroom around social emotional concerns or issues that may arise. It's up to 3 hours a week of consultation for up to 12 weeks. We provide the class tool observation. We have something called the action plan development meeting, where we're meeting with the teaching staff to help co-create some goals and strategies for that classroom. We have up to 8 weeks of support in that classroom for these action plan support meetings. We also will provide the center with a center-wide training on a social emotional topic. And we can include up to 2 child specifics per core classroom service. As you can see from this graphic, the light blue child specific, and then the core classroom is listed below that. So we want to have 2 children nested if at all possible to optimize the supports. As you're working with the classroom, you can actually work with supporting an individual child or children with their own issues as they arise, and hopefully work on them all together. Another level, which is more intensive, is called our intensive site, which is designed to support multiple, in the same year, multiple core classrooms and multiple child-specific services. This would be something that's done, like I said, from September through June, and the expectation is that there's going to be multiple services for that experience. Next slide. Since 2002 in Connecticut, there have been over 1,300 early childhood education centers serviced, which includes 2,900 classrooms and over 15,000 teachers and assistant teachers served. Over 5,900 children and their families were received the child-specific services, and then there was over 42,000 children served in core classroom services combined. At 1 month, it's been evaluated that 99% of the at-risk children were not suspended at the 1 month follow-up, and then 98% of them were still not suspended at the 6 month follow-up. I think this is yours.
Yes, so wanted to tell you a little bit more about the outcome data. Dr. Walter Gilliam, who is with Yale University, conducted 3 actually randomized controlled trials of ECCP, looking at the program and the services we delivered, and using really a clinical research model with a control group and randomized assignment, which is the gold standard for demonstrating clinical research, basically. And as indicated in some of the earlier slides, the documented outcome has shown in his study the first 3 bullets, which are decreasing externalizing behaviors, decreasing impulsivity, and increasing parent and teacher partnership. The last bullet there of 98% of the children were not expelled at 6 months. Follow-up was data that we've been continuing to collect for the program for many, many years. And so his study, which is one of the first studies of infant early childhood mental health consultation, was published in the Journal of the American Academy of Child and Adolescent Psychiatry back in 2017. And it is really recognized nationally, the program, as an evidence-based model using a randomized controlled trial to support its efficacy. And so it is not just the experience of Connecticut or of the model developers, but by an independent researcher who engaged in very rigorous research to look at the program to see if we were able to have the kinds of positive impacts that we wanted to have. And indeed, the studies have demonstrated that that is the case. So next slide for us, and then the final slide, just talking about the benefits of ECCP. We've now in Connecticut have been doing it for 18 years now. We have clearly seen reduced suspension and expulsion of at-risk children. It was our initial goal. It is a metric we continue to track and monitor. And we are very happy to see that when children go through our system who are at risk for suspension or expulsion, the overwhelming majority of them are able to be maintained in their setting. And we do that by building capacities of caretakers. We're about building capacities, working with the adults who help children. So depending on the service, it could be working with the parents, or it could be working with teachers, or child care administrators, or all three, in the service of helping all of the adults involved in young children's lives to be better equipped to support social emotional development of young children, and to learn effective strategies in dealing with young children who might be demonstrating some behavioral problems. The program collects satisfaction data from parents and teachers and administrators, and has consistently had really, really positive feedback through the many years that we've been doing it. Over time, our consultants really have become a resource for social emotional development in their local communities. They provide not just these services that we described, but they also provide any range of number of webinars and informational meetings and brochures and newsletters and what we call tip for tots, little tools that we share with families and providers in terms of how to support young children and how to help really work on positive social emotional development. And over the years, we have really created very effective partnerships by collaborating with existing systems, services, and community resources. We know that people who work with young children are very, very passionate about the care and services that they provide for them. Our goal is to come alongside them and to really listen and understand, and also share our expertise with them in a collaborative way to really help them to be better able, again, to care for the young children that they are working with, and really to help healthy social emotional development. Last bullet point is we've been doing it in Connecticut for 18 years. It really does have a proven track record. We are very excited to be working with the state of Maine. A lot of very important work has already happened over the years by many providers, as well as more recently, as Alyssa outlined, some of the special legislative committees and ultimately statutes to really promote infant early childhood mental health consultation as an important service in your state. And so we really feel it is a tremendous privilege for us to be able to be a part of this with you, and to work hand in hand with you in making this program successful in Maine. The last thing here is our website. It is there listed, ECCPCT.com. Gives you some of the history and has a lot of information and resources on it as well. So I will stop there and turn it back over to Amy, who will describe the next steps for Maine ECCP.
Great. Thank you, Sam and Caroline. And we've been working so closely with ABH since we started the plan to implement this. It's funny how friendly and how warm you can feel toward people who you've only ever met over Zoom. So I want to thank them very much. They've been very good sports, hanging with us through this all. And with COVID, we have had to make a number of 180-degree changes along the way to get this going. But as of this week and last week, actually, our consultants are getting started. So I'll tell you more about that. And just a little bit of background on me. I'm the Maine ECCP program manager. I'm a manager at Children's Behavioral Health Services, where the ECC program lives within OCFS. And it's a nice, the ECCP program is a nice little bridge within OCFS between our Children's Behavioral Health Services and our childcare programs, which Crystal Arbor oversees. So we're very excited to be getting ECCP and early childhood mental health consultation going in a systematic way in Maine, and we know it is a service that's going to help a lot of providers and families out there and kids. So here's where we are with Maine ECCP. We are piloting the program over the next 2 years in 5 counties: Androscoggin, Aroostook, Cumberland, Kennebec, and Penobscot. Within each of these counties, there will be one full-time ECCP consultant who's just dedicated to ECCP, and they're all employees of licensed mental health agencies versus being employees of OCFS or some other configuration. We did that very deliberately. These are licensed clinicians who are mental health professionals. They have a lot of experience working in the field with children and families in various ways and settings. We have consultants hired in each of these counties so far, except for Penobscot, which we're still actively recruiting for. We have 2 agencies that we have contracted with through the department to employ these consultants. Community Care for Androscoggin, Cumberland, and Penobscot, and CHNCS with Aroostook and Kennebec. We contracted with them after an RFP process that we did back in the fall, and these agencies were the awarded bidders, and successfully we have hired 4 out of the 5 consultants. And I've been an LCSW and a clinician and social worker for more years than I care to say, in Maine and other states. And let me tell you, these consultants are impressive. They're a great group. They have a ton of experience and they are excited to do this work. It takes a lot to impress me with another clinician, and these guys impress me. So I think those of you who will be fortunate enough to work with them or meet them, I think you will get a lot out of working with them. So we're excited to have them. So I want to move on. This is how, just to give you a little bit of background, ECCP services are going to be provided at no charge through the provider or the family. It's not a Maine Care billable service. The funding for this program is through a combination of state general funds and Child Care Development Block Grant or CCDF funds. So a child doesn't need to meet eligibility criteria or anything like that with insurance. It's if a provider or feels like this would be helpful for a child to help them be successful in their early care and education setting, and they meet the program criteria, then they can receive it, and we don't have to worry about insurance or anything like that. Here's the timeline for implementation. We're doing a very deliberate phased approach because the legislation calls for us to work with these various different types of settings and prove that we can use a model and maintain fidelity to it and have it be efficient. Before we implement it statewide, we decided to go with this very phased approach so that we can make sure that the consultants get practice in each different type of setting and that they can dedicate the time and energy to making sure that we can do this model with fidelity in each type of setting before we roll it out statewide, if and when we're able to do that. So we're starting this winter. The consultants recently wrapped up 2 weeks of very intense training in the ECCP model. And they wrapped that up and that was done a week ago Friday. So their first sort of training classrooms we chose Head Start classrooms for them to kind of pilot the model. This is a new model to them. These are all licensed clinicians. They're very familiar with working with children and families, but this is a new kind of work for them where they'll be partnering with childcare providers. And Head Start has a good track record of using mental health consultation. And we felt like that would just be a good place for them to sort of get their feet wet with ECCP and work out the kinks in their training and everything before we broaden the reach and open it up more widely. So they'll be doing their initial work in Head Start over the winter, and then in the late winter, early spring, we will be selecting classrooms and sites for them to work at licensed childcare centers, so center-based providers. And then in the summer, we will be opening up to licensed family childcare providers. And then through the fall, we will be opening up to public schools, because the legislation calls for us to work with children ages 0 to 8. We're going to open it up to those primary grade levels. So pre-K, there are a number of districts who have public pre-K programs. So pre-K through 8 years old, whatever grade level that is with the child. And we'll be working with the Department of Education to implement that in that setting. We'll also be starting working with resource parents and child welfare caseworkers in fall of 2021. So children who are 0 to 8, who are in our child welfare system, who may be having trouble in their early care education setting, and need some extra support from an ECCP consultant to make that setting successful for them. And then finally, in spring of 2022, we aim to start opening up to licensed after-school programs. So any licensed after-school child care provider that serves kids up to age 8 and would like some support. I know from experience that sometimes when I have a very active boy, and sometimes I love our after school provider in my community, but it can be challenging. There's a mix of kids in there. And so we're excited to be able to offer it to after school programs as well. So that's our timeline. We're doing, in order to, our consultants have a very kind of tight caseload, and that's so they can give a lot of attention at one time to the sites and the kids that they're working with. And so because of that, and because of our need to demonstrate fidelity in each of these settings, we're sort of doing a very guided site selection process. The department will be identifying sites for the consultants to work at in each of these types of settings, so that they can demonstrate their ability to use the model effectively. So I'll move on. So I wanted to mention COVID as well. COVID has been in every conversation we've had about ECCP and how we're going to do this effectively and with fidelity to the model. In Connecticut, I know they've done some great work adapting their program to be used with telehealth and virtually. I believe they went virtual back in March when everything kind of shut down, and have been doing that ever since. In Maine, we really want the consultants to be able to learn the in-person model, the ECCP model, as it truly was developed and is most effective. And so we'll be striving to work in person, but we have the ability to use some virtual adaptations if we need to. Of course, as our consultants go into childcare settings, we will be following all of the guidelines around COVID-19. The consultants will be provided with PPE. They will follow all the licensing requirements and all of the guidance around that. And so with that, before we move on to the poll, I just wanted to mention one thing. I'm fortunate to have a number of partners in building ECCP, so I wanted to say and reassure folks we've been working with MRTQ, childcare licensing, CDS, Head Start, the CCC, the ECHO program. We've spoken to the Maine Infant Mental Health Association, Maine ECCP. We will be reaching out to the Maine Family Childcare Association. You guys are next on my list to reach out to. And so we've been making connections with a number of stakeholders as we've been making our implementation plan to make sure folks are aware that we're here and that we're coming, and make sure that we put our services out there in a way that works for as many people as possible, and answer any questions along the way. So I just want to mention that. So we have a poll question. So I'm going to ask our host, Chris from MRTQ, to put the poll question out there, and we'll give you guys a few seconds to respond. Now that you've heard the first question, if you're an early childcare educator or provider, based on what you've heard so far, would you be interested in receiving ECCP services at your site? And if you respond yes, if you could let us know what type of site. We're always trying to get a gauge of interest and see if folks are interested in receiving the service. I can't vote. It's telling me hosts and panelists cannot vote. All right, we'll give you guys, I feel like I should play the Jeopardy tune. All right, Chris, whenever you're ready to put the results up. All right, so if you're an early childcare educator provider, would you be interested in receiving ECCP services? 71% say yes, 8% say no, and there's 21% who are unsure, which is totally understandable. This is a new program. I'm sure there are a lot of questions. We're gonna go into Q&A in a minute. And then if yes, indicate your setting type. So 33% who were interested are Head Start, 25% were center-based, 8% family childcares, nursery schools, and public pre-Ks came in at 4%. Others were 25%. So I'd be interested in hearing more about who those folks are. So I'm going to close the poll. Thank you all for answering that poll question. That was fun. All right. It's my first time doing a webinar poll. I like that technology. All right, so we're going to do Q&A, and there's a Q&A box. I'm going to stop sharing because I can't monitor the Q&A while I have the slides up. So I'm going to stop sharing. I'm going to go into the Q&A. We have one question so far. So this is from Megan Barnes. If our program has adopted a specific approach to dealing with challenging behaviors, like the pyramid approach or to challenging behaviors, does the ECCP consultant support the staff in implementing our adopted approach? All of our staff are trained in this approach and continue to follow this program. This is a great question, and I'm going to have our esteemed colleagues, Caroline and Sam, answer that question if they can. I could answer it, but I think they have way more knowledge and experience in this. I'm still in the learning phase. So Caroline, what would you have to say?
Yes, I mean, we here in Connecticut, we work closely with our Connecticut State Pyramid Partnership Leadership Team. I'm on it, as a matter of fact. And all our work is in the social emotional realm. And the strategies that we use really do help to support the pyramid model in the implementation of that structure. We have our consultants gain knowledge in the pyramid process. Some of them actually already come with it based on their past roles. And so the idea would be that they're there to help support you in some of that. While we don't provide specific implementation and technical assistance to the pyramid model, our work does help support it, definitely. Is that helpful?
Yes, very helpful. Thank you.
In the chat room, we also have some questions as well.
I see that. Alyssa, I know there was a question in the chat that you wanted to respond to.
There was a funding question about, will this service become Medicaid or Medicare reimbursable eventually? That's something we are definitely exploring. We're looking at all kinds of funding sources for this program and what can make it sustainable. We are trying to figure out if there are other states who have successfully used their Medicaid system to reimburse consultation. What we're finding is that one of the challenges is because it's not always a targeted Medicaid member, that it makes it really hard to use federal Medicaid monies to support an entire classroom without being able to bill under a specific member. So we are committed to exploring whether or not this can happen and finding creative ways to work with the Centers for Medicaid to figure out possibly if this could be a long-term sustainable funding stream for this service. Good question.
All right. That was a great question. So I have one question in the Q&A. from Ann Berry. Would this work within the BHH service? And I'm assuming that means behavioral health home service. Well, to receive the service, to qualify for the service as it stands right now, you need to be a childcare provider, a licensed childcare provider, or a child who is receiving early care and education services. If I'd have to hear more about what the particular need is in that situation to make a better response to that. And at the end, I'm going to give you we have a general email box for the ECCP program, which is monitored daily. And you also have my contact information. So if you want to follow up on that and we can talk it through, I'm happy to do that. Okay, so question from Monica. How does the ECCP consultant intersect with a contracted mental health provider or instructional coaches working with teachers? That is a great question. And I'm going to throw it to Caroline and Sam as well. Sorry, Caroline. You're muted, Caroline.
I'm trying to read the question and but I'm blocking my unmute. So we'll work with whomever at the school that the child care center wants us to work at, or the educational center wants us to work at. Our goal is to collaborate. So we really don't want to overstep or ask either the teachers or the families, whomever it is that we're working with, to do two different things. So we want to kind of bring everyone together and help support some of the work that's already being done, as well as kind of maybe help support it and launch off, so that we're not necessarily involved as just because we're consultants, if that helps.
Mm-hmm. I think that helps. If that didn't quite answer your question, Monica, just let us know in the Q&A or in the chat, and we'll see what we can do. Okay. So another question, how are parents involved in ECCP? Great question. Again, Caroline.
So we have a child-specific service where we're working with the parents and the child care, early care and education staff to really bring them together in their conversations. And they really are the experts on the child. So we're asking for their feedback, their history, what their wishes are for the program. We do what we call a home observation visit, where we're having a visit in the home with the family. And then we can provide support visits to the child, for the child at either the school or at the home, or one of each. And the nice part about this is that, again, we're really trying to work to have the parents or caregivers collaborate with their school systems regarding their children, so that we can enhance any and keep going any good communication that's already going on and build upon it from there.
Right, absolutely. And parents have to give consent whenever we do child-specific service. Every service we do is completely voluntary, so everybody has to be on board. All right, so I had a question or comment in the chat about somebody was letting us know they're in the other category because it's a special purpose preschool. And a preschool would be a perfectly great setting, even a special purpose one for ECCP. Again, it depends on the particular need in your classroom or the particular need with the child. One criteria for ECCP is not designed to work for children who are already just diagnosed with an autism spectrum disorder. It's beyond the scope of the service. So a child who you're thinking of referring for as child specific, for that one we wouldn't be able to work with, but we can work in classrooms that have children with various needs in them. So again, it would depend on the situation and what you're looking for, but we're open. We can have a conversation about that for sure. Okay. Anne is asking in the Q&A, who makes the referrals, the child care providers or the schools? In Connecticut, providers can refer themselves, schools can refer themselves, parents can self-refer saying their kid's having trouble in childcare, but the consultant would reach out to the provider and make sure everybody's on board before services start. In Maine, in our situation, because we're doing this very careful pilot, we're working the department is reaching out to sites to see if they want to receive the service, and making that partnership there in that phased approach that I showed you earlier. So going in order. So we're working with licensed centers next. If you're interested in receiving this service, again, my contact information will be at the end, and you can certainly direct your inquiries that way. And we can follow up if and when the consultants have some capacity with that. Another question, is ECCP in any other states? Good question. Connecticut. Is ECCP in any other state?
I mean, I could probably take that.
Okay, Liz, great.
Just to give Caroline a break, that we had piloted ECCP through some FEMA dollars in Long Island in New York. So we had a nice pilot with that. Again, the funding was limited, and had some really good success with the model, in that, and it was quite, a diverse setting, there was diversity in the settings that it was engaged with. So we felt pretty confident with our experience there, that ECCP could in fact be transported, to another state. And certainly Maine is nothing like New York City, more similar to Connecticut. So we were feeling pretty comfortable with this type of transportation of the model.
Sam and Caroline, do you want to add anything to that?
No, that hits all the high points.
All right. Question from Monica. With COVID practices in place, our classrooms have fewer children and more teachers in classrooms. And this year we are not experiencing the same sort of challenges we experience in typical years, as we have the staffing to allow more support and intervention. That makes a lot of sense, actually. How have folks found the ECCP project working within the pandemic? That is a great question. So Sam, I'm going to ask you to take that one.
Sure. I'll start, and maybe Caroline can add. The pandemic in Connecticut has been much worse than it is in Maine. So in March of last year, probably 85% of the centers we were working with closed, either temporarily or permanently, as a result of the COVID situation back in March of 2020, and for probably the first 4 to 6 weeks after that, just because the rate of infection was just so high in our state, closer to New York. Lots of commuters that went between Southern Connecticut and into New York City. We developed a teleconsultation model, nonetheless, to try to provide consultation services, ECCP-like services, as an adaptation to our standard approach. They've been very well received, but the COVID virus in Connecticut is still up and down. There have been surges, so we have seen some disruption because childcare settings have had to close, or teachers have had to go into quarantine or isolation because they've been exposed to COVID. And so it has been something that we've continued to adapt and respond to the realities of COVID for centers where we have been able to have a sustained contact through our teleconsultation services. Both families and centers have really reported to us that it has been a great service. It's just been much more impact of COVID in our communities that we have served predominantly. We're still providing lots of consultation through phone and email, as well as providing some more intensive services via a video conferencing kind of platform.
And I would add, if I could, The issues that we're seeing now predominantly focus on stress management for both the children and the caretakers, be it the parents, the center staff. And so we've been doing a lot of work to support the center directors or administration around common practices, helping them understand that we don't in fact know what the next steps are for COVID and the pandemic and how that's going to influence communities, but how can they help support their staff in terms of a response that helps support them and help reduce their levels of stress and anxieties, which in turn then impact the children under their care. And then also just the not knowing if they're in person or not, and then how to help parents, in terms of what are the expectations around things like Zoom meetings and that type of thing. So how do you help support the families who are now with their children more than they had anticipated that they would be at this time? So.
Great, thank you. Another question, we have a couple more questions. We have about 10, 15 more minutes planned, and we can take some more questions. So question, will the consultants be fingerprinted? That is a great question. And actually, Alyssa and I had this conversation at the end of last week, and Caroline and Sam haven't discussed this with you yet. But yes, our consultants will be fingerprinted. And we know it's as they're going in as consultants and not as employees, they're not required under the current statute, but we decided that we should go ahead and have them fingerprinted, and we'll be working with them to do that. Because I know especially Head Starts have certain criteria they want to meet, and we'll just get that done. So another question, can a consultant be in a class where CDS or Child Development Services is also working with the child? Again, that depends. It depends on what the child is using CDS for. If the child is receiving mental health services, and Caroline, Sam, if I'm, feel free to speak up and add to this. If a child is receiving mental health services, either through CDS or through another source, a mental health agency or a private practitioner, we would not see the child. We could work with the classroom through a core classroom service on a wider basis, but we wouldn't do a child-specific service for that child, simply because we wouldn't want to muddy the waters with another cook in the kitchen, so to speak. We would want that child and family to focus on working with their current provider. But that doesn't preclude us from doing a core classroom service to work with the teacher and the classroom as a whole. Anything to add there, Caroline? Okay, I said it right. Another question, can a classroom have ECCP more than once? That is a great question. What do you think, ABH folks?
Well, here in Connecticut, what we do is we try to spread the consultants out to a variety of centers over time. The idea is that we probably in the same year wouldn't service them, but maybe in subsequent years we would. So, but that's not to say that we can't work with a child once, at a later date, if we're not opening another core classroom service immediately. So if down the line another need arises, we would talk about how we might be able to support. Chances are we'd have a conversation with that teaching staff, be it the director, the administration, or the teachers themselves, to maybe re-support some of the strategies that we may have come up with in the past, to see how they might be able to implement the same strategies that they're used to and familiar with again, or with a different group of children, without opening that classroom in that same year.
I'm muted. Okay, thank you. I don't have any more questions hanging out in the chat or the Q&A. So I'm going to reshare my screen just so we can get the contact information up, and then we might be able to wrap this up a little earlier than planned. And I know you all are very busy. And those of you who are childcare providers probably managed to sneak this in during the kids' nap time or rest time. So here's contact information. Again, if you're interested in receiving services, again, we're in the 5 pilot counties for now, for the next year or two. Androscoggin, Aroostook, Cumberland, Kennebec, and Penobscot. If you're in one of those counties and you're potentially interested in the service, please send me an email or call, and we'll talk about it. If you have any, if a question comes up and you didn't get it into the chat or the Q&A here, you can please send an email to eccprogram@maine.gov, or you can send it to me directly. That's fine too. Once we broaden it or we have other announcements to make, we will make sure to get that out through the listserv and other sources. One more question actually just came in, and I'm going to take it. So, do you plan to deliver any trainings beyond specific classrooms, for example, for a group of educators? That's a great question. Usually as part of the program, we do trainings on a social emotional topic for the centers or for the centers that we're working with. Beyond that, I think, that's again up for discussion. ABH, what typically happens in Connecticut?
We do have, each consultant does 3 social emotional trainings per year.
Mm-hmm.
So they are community-based training. So once they're fully up and running, that's something that we can plan for, I'm sure.
Yeah, great. And again, they're just starting out this week and a little bit last week. So it's going to be a little while till they get up and running, making those community partnerships and joining their local networks for people working in early childhood education. And especially with COVID, that's probably going to look even more a little bit delayed, since a lot of those programs may be, a lot of those networks may be not meeting as frequently or over Zoom. But you can expect to see them popping up as soon as they're through with their initial classrooms and getting on their feet and ready to go. Thank you all for joining us. We're so glad we can let more people know about this, and we're very proud to be able to offer this to the state. And we thank everybody for your support. And if you have any other questions or comments, feel free to reach out to us through the contact information here. And I think we'll wrap up. Have a great day, everybody.